Hello, doctor. I just wanted to give you a quick demo. Cindy mentioned that you would like to take a look at a video. So I'm going to do this very briefly just so that you can see the workflows within PrognoCIS. I think you'll like them a lot. I'm logging in here as a provider, and I'm going to come back to yesterday, which is a little bit more of a specific day with more appointments. So you'll see immediately you come to a nice dashboard. It lets you see what you've got going on. So if there's patient schedule, you can see who those patients are, why they're coming in, and you can see your status of how things are going. So as you're completing work on a patient, you sign off their chart. It'll say complete, as in these two. You can see as patients are being checked in. So I can see Mr. James Jacks. He was scheduled at 1:30, but he showed up very late at 2:38, here for a health checkup. He's been taken to room 9. He's a little bit dizzy. So you can see all this information very nicely. Also, I can see open encounters on my open encounter tab. This is my work in process, all the charts that I've got opened, but I haven't signed off. So if I needed to come back to this person from June 2nd for Mr. Ron Horton, when I sign off of his chart, he will no longer appear on my open encounter list. So obviously nice to keep this list as short as possible. Everyone has a nice inbox message summary. So in the upper left, I can see I've got 24 to-do items, 13 of them are past due. I have a telephone message someone's taken. Your lab results from Quest, LabCorp, etc. will come in. So you can always come into your inbox right here just by tapping. And if you said, okay, I want to look at my telephone messages or just my to-do items or urgent items, you can do that. And of course, I can see those messages. I can pull them up. I can reply, forward to someone else if I need to. Also easy to navigate. You'll notice the tabs up here as I move along. Maybe I'd actually like to go look at the schedule itself. And so I'm going to jump back to yesterday where I have a few more appointments. And I can be looking at multiple providers in a practice, or I could just, if I'm a solo practitioner, I could just be looking at one weekly view if I want, or a daily view. And these colors are entirely up to you. Green might be new patient, blue might be follow-up. If you get a call about a patient who needs to come in, let's say tomorrow, staff can simply just tap on there and they can say, okay, maybe this is Jane Hernandez. And now if it's a new patient, they can instantly register someone, but I'm going to choose an existing person. Immediately it tells us if there's anything important that we need to be aware of, so we can see that. And then I can decide, okay, what kind of an appointment? Maybe she's coming in for a yearly visit. And also having headaches, so I can put this information in, and we can make that appointment, or we can put her on a waiting list if we want. You'll see that Jane Hernandez is now on the schedule for Thursday at that time, and in the lower left I've got a nice hyperlink, so if I wanted to quickly see some information about that person, I can see it. I can see her phone numbers if I need to update those. Also, these tabs here allow us to see other things quickly. Who's her employer, emergency contact, her language, race, ethnicity for things like meaningful use, MACRA, primary care physicians, other people that you might want to keep track of that are involved in her care. And you can automatically CC them in any communications. And then billing wise, what does that patient owe versus what does the responsible party owe, etc. So you can see all of these things with these tabs. And also, just above the photo, your staff can quickly get to her insurance. They can check eligibility. If they need to add a secondary to that, they can quickly do that as well. There's many other things. You can have patients sign consent forms electronically. You have auto text reminders, etc. So all of these things are available. I'm going to jump just more towards the documentation side. So let's say that you're going to work on one of the patients that are scheduled today. It doesn't have to be one of these. You could work on someone right off the bat just by using this button here. You can search for any patient and start an encounter yourself. But we'll say that it's someone who's scheduled today. So James White, he's complaining of ankle pain. He's in room 4. I'm going to just tap on his name, and I come into a nice clinical snapshot. Shows me everything at a quick glance that's been going on with him. Anything in yellow means it was auto-copied. So I know that he has been here before. If this information had just been entered today, it would be in a blue color. Anything that changes today will be in a blue color. But this is very customizable, very flexible. And if I want to, I could say, okay, what happened last time? I can have multiple face sheets. So if I wanted to just quickly see what happened the last time he was here, I can do that. If I wanted to look at his labs, I can come over here to the labs, and I may want to go out a long period of time to see all of his history of labs. And I can see those. I can trend the data over time as well. Now maybe I would like to look at his vital signs. So I can come here to the vitals. I can see that I actually have it configured to copy the vitals over automatically. So if, let's say you don't have to do this. You can have it to where you want to require labs, or I'm sorry, vitals to be taken each time. But you'll see that if something changes today, you see how the color changes, not only the weight, but also the BMI and the BSA calculation. Now you can also see history using the history button. I can see those vitals over time. If I wanted to graph any of these things, I could do it. And you can go through your workflows very simply just using these green arrows, which are very configurable. You might have a follow-up workflow that just with 2 clicks you're done. Or if it's an first-time visit, then it might be a couple of more, but you get through your visit very quick. Now, since he's been here before, notice that I have it, so it's pulling up what we talked about last time. He talked about diabetes last time, and I can see those things in yellow. Only the things that were addressed show that have a check mark. Now, maybe today I want to follow up on this, and he is starting to take blood sugar readings, and he's taking them now twice a day, and we could put in whatever those readings might be on those. And anything else that I might want to do. So I can see that. But I can see here from the appointment, he's actually coming in for ankle pain. Now I can just start to type ankle pain, or if I wanted to just jump into a list of all of the different reasons that patients come to see you, and I could say, well, okay, we think it's a ankle foot injury. He's also bringing up that he has a kind of a rapid heartbeat. So we can bring up these things quickly. We have the nice templates that we can always use, or we can just simply jump down to the bottom and we can just type if we want, or we can use Dragon, we can use Siri. So it's very flexible. You don't have to use these templates, even though they're very nice. They're in here, and if you want to customize them yourself, it's very easy to customize. You can customize right on the fly without having to go to a specific maintenance area. You can just do it right on the fly if you want to. So I can document this regarding his ankle problem. If I highlight the arrhythmia, I've got a totally different set of questions. And again, I could just come down to the bottom if I wanted, or I can just simply use my template again. This has been going on for 2 days. We think that it's because there's a family history, and he's also had hypertension. Now you can customize on the fly if you think of something you'd like to add to this template so it's available for future patients. What's his current way of treating, or how has this been treated up to this point? He's taking home blood pressure and he has a pacemaker. Okay, so maybe I'm done with that. And maybe for today we're going to make the ankle problem is going to be the main thing that we're going to discuss as the chief complaint. And I can just simply follow my green arrow if I want to. You'll notice it's pointing to the review of systems. Here, again, I have it copying over from last time, but I can do away with this and I can do a brand new review of systems. Any of the areas with a red box are the areas he had a problem. So respiratory, it's because he was complaining of asthma symptoms. Well, maybe today he's not having that anymore. It seems to be doing better. Shortness of breath, of course, better too. But he does bring up something else. He brings up maybe something about genitourinary. I can quickly mark that, and I can be more specific about what the problem is. And then the green arrow at the bottom right is taking me to an objective exam. And here it pulls up a nice physical. I could go ahead and use this, or I could say, this really needs to be a little bit more comprehensive. Or I'd like to pull up the upper respiratory physical, or the foot physical. So you can have all of these nice workflows. Now, if I see some things immediately that there's some problems, maybe he's in some mild distress, I can quickly mark those. I can put my comments to the right. I can also jump into my favorite phrases. Maybe he appears to be in pain. He's unable to sit still. When I look at his ears, I see that maybe there's a discharge from the left side, and so on. So notice I'm just marking some positives, but I could, if everything else is okay, I could just come up here and with the one tap, notice I can mark everything else as negative, and I have not disturbed those positives that I already marked. And of course, I could still keep going. If I say, hey, this is not right, and this is not right, I can quickly mark those things quickly. regarding this patient. And everything that we're doing is all going towards nice documentation. So you can always look at your note at any time. You can instantly send this to another physician as well. So you'll see regarding the ankle injury, it's done a nice note for that. The diabetes, the arthritis, the arrhythmia is all right there. And I've got all this history stuff. This is more like a detailed H&P, but it could be a simple SOAP note. It's bringing in all of his history here. Review of systems, any of the positives I can see clearly in red. Same thing for the physical exam. Now you can always bring in photographs if you want to, or maybe you'd like to annotate on some diagrams. You can always come into your nice library and indicate, this patient, I can see something in his eye that's not quite right. He has a foreign body. I can use the foreign body icon, or I can do freeform drawing. He might also have a kind of a sty on the lid of his eye. And notice I have areas here I can put in comments. So any of the diagrams, any photographs, all of those things will be, a part of the note. And it's all getting nicely added. Now, you can always jump off to someone else, or you might suddenly have something that pops into your head. These little buttons in the upper right are always available. So my compose button here lets me quickly send a task, or maybe I just want to make a note of something that needs to go into a patient's chart. If I send it as a task, I can mark it as urgent. That means it's going to pop up in front of the person. If I just want taking a telephone message for someone, I can indicate, it's for Deanne. Is it regarding this patient or another patient, or maybe it doesn't even relate to a patient at all? So I can choose them. I can choose from my action list. We need to call the patient within the next day, 2 days, and regarding his meds, maybe having a reaction. So you can quickly get this there. And if there's anything that I need to attach from his chart, I can use this button to easily attach something. But otherwise, I'm just taking a telephone message for Deanne regarding this patient, Mark Hammond, and getting that into his chart. And it'll be in her inbox. With this patient, as I'm coming back to them, I can always come to my assessment. Notice here the system can help me with the ICDs. So here I've got, for the diabetes, it's got the ICD-10. ICD-9 is also still there visible in case you want to refer to it. I can see here for the ankle sprain, as I highlight it, notice that it shows you your preferred way of handling that particular problem. But you can always change that. You can always overwrite it. You can choose a different phrase from your library. If the patient has any questions, maybe on the cardiac dysrhythmia, you've got your education notes or documents right here. So this ties right into Medline Plus based on the ICD-10, and the patient may be interested in having a printout or just emailing it, or you could deliver it to the patient portal, whatever they prefer. So you can get that right there quickly. Down here, notice I also have a RX button and an order sheet button. So for e-prescribing, if I wanted to prescribe something, it knows the patient's preferred pharmacy. I can jump into my preferred meds, or I can choose something completely different. If I choose from my preferreds, it has all of my preferred way of giving that medication. And so I've got it right here unless I want to change something about it. But otherwise, I can just hit the ERX. Notice here it'll tell me if there's a problem with this patient, if there's a drug to drug, drug to allergy, drug to disease, and I can decide whether I want to make that anyway. I can bring in that patient's medication history based on their visits to other providers. I can easily refill medications that we've given them or put a stop to those meds if needed. So you can really get to a lot of things, but these don't have to slow you down. I'm just pointing out all the different things there are, but you really don't have to be burdened by going through these screens. These are just there if you need them. You also have an order sheet. So the order sheet allows me to quickly pull up, okay, maybe I'd like to get a radiology done for the patient's ankle, one view of the left. So I can go ahead and create that order myself, or I can put it on an order sheet for someone else to finalize. But you can send that requisition straight over to the radiology facility, or you can just print it out if you want to. You can also indicate follow-up. Maybe he should come back and see you again in 1 week, and the reason, just want to review progress on the ankle. So this would typically go as a pop-up message to the front desk. The front desk will see that that needs to be done as that patient is checking out. For the CPT, I can come here and I can choose from my preferred CPTs, or I can jump into the entire CPT database if I want. We also have a very nice E&M calculator, so you don't have to even guess about the code. You could just get right to it and be able to select it. So with that, maybe I'm done. I'm going to just go ahead and close my encounter here. Gives me a nice summary of what we've done. I just prescribed a medication. I didn't do any labs or radiologies. I didn't send letters out to anyone. But I have my follow-up in 1 week to review progress. That's already gone to the front desk, and I'm just going to mark the encounter complete. And if this note needs to be signed off by someone else, it can go to their inbox. So we have a very nice workflow for that. But in this case here, it's actually prompting me. It's saying there's another doctor involved in this patient's care. Do you want to send a letter to them? So just by tapping yes, it'll automatically send a nice letter, thanking them for, being involved in their care, and this is what we talked about, and the plan, and so on. For meaningful use or macro MIPS, do I want to provide a clinical summary for the patient? So if I say yes, I can do that myself, or I can have the front desk do it. And you'll see here, it's got it right in front of me. Now I can print it, or I can just say, how about to the portal? I'll send it to the portal for you, Mr. White, and you can see it there. And then, of course, anything I'm missing as far as my measures, it will let me know with a green thumbs up or a red thumbs down, so you can really make sure that patient by patient you're getting those things. Otherwise, I'm finished with this patient, and as I come back to my home page, notice another patient is now complete. Okay, so makes it very, very easy. And of course, everything that we're doing here is on the clinical side, but over on the billing side, and I can't remember if you needed to use billing, but you can use our billing if you want to. It's not mandatory. You may already have an outside billing service, but this here comes over to a nice billing dashboard. The billing staff, they can see the number of claims ready to send if they're in the middle of EOBs, how much in co-pays collected, how much is due from insurance, from patients. And here, as you completed the work on that patient, Mr. James White, they can see here it's ready to bill. So they might want to just take a quick look. They highlight that line and they use this little button that looks like a claim form. And as they come in, they can see those diagnoses that we chose. They can see the CPTs. Now, maybe they need to change it. They need to add a modifier or add another code that was left off by accident. They can do that. Maybe it would be good for them to look at your progress note because they're not quite sure why you chose the code that you did. So with this button activated, and you can decide whether it should be activated for your billing people, the billers would have the ability to come in here and they could see the note for themselves. And then they could say, okay, that makes sense. I understand now why that particular code was chosen. But otherwise they say, yep, that's ready, good. And they can send those claims out whenever they're ready. They can say, okay, from the claims menu, send claims, and it automatically gathers all of those claims that are ready to go. They can select them all, hit the process button to send them, and on the way they are. There's always other things like posting EOBs, accounts receivable follow-up, very good reporting. So you can run reports, but you also have very nice analytics as well. So if you just want to get a quick snapshot of how the practice is doing, you can always come in here and say, okay, well, let's do a quick analysis of last year by provider, by location. So you have really nice things that you can zero in on, and it quickly gives you that snapshot of things like patient seen. But all of these graphs, you can decide what is key information for you. What are the things that you would want to see. But just gives it a nice, easy way for you to keep track of the health of your practice. And PrognoCIS does it in a very fluid, very easy way. We've been in business since 2002. We're up to date with all the, just about to release the macro and the MIPS, and we've always been up to date with all the measures. You have very nice dashboards to see those things. They're all right here. You can do analysis to make sure that you are going to meet confidently all of your measures that you need to do across all the patients. Also have a very nice way to bring documents in. So as faxes come in, you're able to see those nice and quickly, and you can use this nice little dashboard here to quickly get things into the patient's charts, and you can categorize and subcategorize according to your own preferences, and these things can be sent to your inbox when the staff hits the attach button. So very good. I just wanted to give you a quick overview. I hope that was helpful and didn't take too much of your time. Please give me a call, or Cindy, please call me anytime. My phone number, area code 209-604-6531. That's 209-604-6531. Thank you very much.